Good afternoon, good evening, County of Marin residents. My name is Benita McLaren. I'm the Director of Health and Human Services for the County of Marin. I'm happy to be with you here tonight. We're having our first in a series of COVID-19 HHS information sessions for the County of Marin to let you know about some of the services that we provide here in the County of Marin, especially during this time of COVID response. I want to let you know that we feel very privileged to have this opportunity to come before you using our new virtual platforms to reach a wider and broader audience, and that we're here to engage our community in more ways, in different ways. We've done a lot of promotion and discussion about HHS COVID response over the last 9 months. And tonight is about our programs and services that we typically provide. Those who have needs in our population are expanding during the pandemic. We've seen a rise in unemployment, in food insecurity, depression, substance use, suicide, in protective services, and other needs in our community. And although some of our referrals and things like protective services are down, we worry that abuse and neglect of vulnerable children and families is likely happening, but not being reported at the same level as when kids were in full-time schools and older adults were out and about in the community. So we're here tonight with the opportunity to discuss many of our programs and remind you about our availability, to let you know that during COVID, since the beginning of the COVID, we've been open, our services are open, and we're looking to serve you. I want to make sure that there are often myths and stereotypes about our services and stigma, but we want folks to know that we have a friend, we're a friendly organization, service oriented, or if you have a family member yourself or a neighbor who could benefit from our services, we want you to pass along the information. This year, we really need to be looking out, as always, but especially this year in COVID, we want to be looking out for each other and let you know that you have a friendly face in Health and Human Services. Before I go on, I want to thank all the dedicated Health and Human Services staff who are not only on the call, but represent the several hundreds of staff that we have in HNHS that continue throughout the COVID response to be dedicated service daily, day in and day out. They have continued to press on despite the risk to their own personal safety to make sure that our community is supported. And they will continue to do that, not only continuing to do their regular work, but also many of them have volunteered to be disaster service workers. Our staff are highly dedicated professionals who really are committed to service to community and really mean that every day in every part of their work. So without any further ado, I want to just, one thing I want to let you know before I go on and turn over the baton is that we will repeat this town hall with the same information conducted in Spanish in about 2 weeks on December 1st at 5:30 p.m. So thank you again for tuning in to hear about the services for Health and Human Services. And if someone didn't get to see the video tonight, we will post the video and you can look at another date. Please tell your friends and family about our services. So without any further ado, I'm going to turn it over to our Health and Human Services Director, Carrie Biermann, and she's going to take us on in our presentation for tonight. And thank you, Carrie.
Thank you so much, Benita. Good evening, everyone. I'm Carrie Biermann. I'm the Social Services Director here at the County of Marin. Thank you so much for joining us tonight. This is a great opportunity for us to share some of our programs and services, and we're really excited to be doing that. I want to introduce the panel of speakers for this evening. Let me first start by introducing Connie Moreno-Peraza. She is a division director in behavioral health, our adult system of care, and she has been my partner in planning these sessions. So thank you, Connie. And if everybody could just give a wave when I announce your name, I'm going to say people in order of appearance. So first, we're going to hear from Jeremy Duvall. Jeremy is a senior eligibility worker, and he's going to be talking about Calfresh this evening. Next will be Josette Malloy, who is a supervising employment development counselor, and she will be talking about our Career Resource Center, Career Point Marin. Camille Jolly is a unit supervisor in Adult Protective Services, and she will be talking to us about Adult Protective Services. Tony Milani is a senior child welfare worker, and he will talk to us about Child Protective Services. Mark Vanderskoff is a division director and our county public guardian, and he will be talking to us a little bit about the Public Guardian's Office and Conservatorship. Moving on to our wonderful behavioral health team, we have Maria Rea. She is a bilingual mental health practitioner, and she's going to be talking about community engagement and outreach. That will be followed by Jessica Diaz, who's a unit supervisor in behavioral health, and she will be talking about the access team. Todd Paler is a program manager, and he will be talking about our crisis stabilization unit. And then finally, we have Jordan Hall, who's a program manager with behavioral health, and she will be talking about substance use services and the Helen Vine Detox Center. So a very packed evening. We're going to try to keep it to 5 minutes a piece so that there will be sufficient time for Q&A at the end. If you look at the bottom of your screen, you should see the Q&A function. And we really encourage you, if something strikes you as a question, please put it into the Q&A. I'm going to be monitoring that, and we will get to all the questions at the end. We will try our best to answer all the questions if there are duplications or things that that seem to be answered by the presentation. I can point that out as well and get them to the correct speaker. So without further ado, I am going to turn it over to our first speaker, Jeremy Duvall.
Thanks, Carrie. As Carrie mentioned, my name is Jeremy Duvall. I am an eligibility worker with Marin County, born and raised in Marin, so I'm really excited to be here with you guys to talk about all things Calfresh. So Calfresh, formerly known as food stamps, or in other states you might have heard of SNAP, which is the federal name for Calfresh. It's a program that helps those in need with little or low income buy food. And how that works is when you're eligible to Calfresh, you have an EBT card. And on that EBT card, your Calfresh benefits get loaded every month. And essentially that EBT card is just like a check card or an ATM card. And you can use it in a variety of locations. You just pick out your food, go to the counter, you swipe the card just like you would an ATM or check card, pick the EBT option, and you can purchase your food. It's a really discreet and easy way to use your benefits. And those Calfresh benefits can be used on such foods like fruits, vegetables, fish, poultry, bread, milk and cheese, produce, lots of really great and healthy foods. Next slide, please. So currently Marin has 13,247 residents on Calfresh. And what that is that includes households where everyone's on Calfresh. We have a lot of households where one member may be eligible to the household and one member may not be. So really the best way to determine if your household is eligible for Calfresh is to just come in and apply. An eligibility worker's job really is to connect our clients with all of the benefits that they're eligible for. So we're really on your side, and during the application process, we'll take you through it step by step and determine what you're eligible for and if you're eligible for Calfresh. The sort of basics of Calfresh eligibility is that you need to either have citizenship, have a green card, have refugee status, asylum, or parolee status. have or being applying for a U or T visa, be an applicant of the VAWA, which is Violence Against Women Act, or a Cuban or Haitian entrant. But really the best thing to do is just apply, and we'll take you through all those steps to figure out your eligibility. Also with Calfresh, besides just the food benefits, being on Calfresh can net you a lot of other great opportunities to get connected with services. For example, PG&E has what they call the CARE program, which if you're eligible for Calfresh, you're usually eligible for that program, which can be up to and over 20% off your PG&E bill, which is really awesome. Comcast has what's called the Internet Essentials program, where you can get high-speed internet for about $10 a month. And you're usually eligible for that program if you're eligible for Calfresh. And also there's a lot of great stuff that farmers markets do where they match your Calfresh benefits. And let's say if you spend $10, they'll give you an extra $10 to purchase vegetables and produce at various farmers markets. So there's a lot of great benefits that sort of come along with Calfresh, besides just the benefits themselves, that you can sort of take part in those other services if you'd like. So slide number 3, please. So how do you apply for Calfresh? There's a couple different ways you can do it. You can apply online at either see4yourself.com or getcalfresh.org. See4Yourself also allows you to apply for other public assistance benefits, whereas calfresh.org, getcalfresh.org is specific to Calfresh. You can also apply in person at any of our locations. Public assistance has some locations spread throughout the county. Our main office is at 120 North Redwood Drive in San Rafael. We have a location in the Canal at Kerner Boulevard, 3240. And then we also have a location at the outstation in Point Reyes at 163 Point Reyes Station. You can also apply by mail. You can call our call center at 877-410-8817. You can request an application. They'll send it out to you. They'll also answer any questions you have about Calfresh. And then once you get that application, you can either fax it back to us or drop it off or mail it back. And all we need to get that application going is your name, your address, and a signature. So I really recommend, if you or your household is interested in Calfresh, to just come in and apply, and your eligibility worker will take you through the process. Thank you.
Hello, everyone. I'm here to represent CareerPoint Moran, and I'm very, very happy to be here to talk with you this evening, because all of us know how important employment is and what happens when you're not employed. So I'd like to tell you a little bit about the services that we have available as part of Health and Human Services that you may or may not be aware of. These services that I'm going to describe are at no cost to you, and anyone can use these services. So please go to the next slide and I'll begin. We are located, CareerPoint Marin, at 120 North Redwood Drive in San Rafael. Knowing that our hours may vary due to what's happening with COVID, whether we're open or closed as of today, our current hours are Monday through Friday. We are open from 9 a.m. to noon, lunch break, and then 1 to 3 p.m. in the afternoon. The phone number that you see is our direct line, 473-3300, and we are located at careerpointnorthbay.org. So I'm not sure what's going on with the slides, but there we go. So this is the one. Thank you. So for those of you who have been around Marin for some time, you may be aware that we used to be called CareerPoint Marin, Marin Employment Connection. Our name has changed, but the services remain the same. And under the Workforce Alliance of the North Bay, we joined a collaboration several years ago, and they became known as CareerPoint Marin. And it also involves CareerPoint Napa, CareerPoint Mendocino, and CareerPoint Lake. Those counties came together because the types of employment that we have are very similar. So our partners that we work with are primarily listed here: the College of Marin, Community Action Marin, the State of California Department of Rehabilitation, the Employment Development Department that I'm going to come back and speak to in a moment, Health and Human Services, the Marin Housing Authority. Petaluma People Services is included because they hold our youth services. Senior Community Services Employment Program for Mature Workers, and Tamalpais Adult and Community Education. These are people that we work together with to provide services to customers who come to Career Point Marin. Next slide, please. For those people who are interested in coming in for job services, we ask that you register in CalJobs, and then you can gain entry into our Career Resource Center, which is now known as our Career Point Center. We have a lot of information and referral to give to you. We have workshops, virtual workshops that take place, hiring events and virtual job fairs. We actually have computer skills classes if you're feeling that you're a little shy in that skill area. And we also have individualized job search and career planning assistance, which is a tremendous help if you're struggling and trying to figure out what you want to do, where you might be able to do it. And all the services that we have are delivered confidentially. So no question too big, too small. So the way to access our services, next slide, please, is to register in CalJobs. Our adult program is open to anyone 18 years and older who has the right to work in the United States. And for males, selective service is required. There are some exceptions, so don't count yourself out. Absolutely come and speak with us. For people who are income eligible or who have been recently laid off, services are open to you. We have training funds that are available in the form of scholarships up to $3,500. Training must be in areas that are in demand for employment in Marin County. But for those of you who may not be interested in going to traditional classroom training, we have earn and learn opportunities that we sometimes call on-the-job training. And that's another wonderful opportunity to explore. And finally, in addition, we are also able to offer support services. So say, for example, that you need scrubs if you're in a training, or you need steel-toed boots, or you need books or supplies or other kinds of materials. Those are things that we may be able to provide to you. So come in and explore, give us a call, see that we're open, and begin your access. Thank you. And the next speaker will be Camille Jolly with Adult Protective Services.
Hi everyone, good evening. My name is Camille Jolly and I'm a supervisor for the Adult Protective Services program within Marin County's Aging and Adult Services. It's an honor to be here and share information about the Adult Protective Services program with our community members today. So Adult Protective Services has around 12 social workers who cover the APS hotline and respond to allegations of abuse, and 1 public health nurse. Adult Protective Services investigates, protects, and we aim to remedy the abuse of older adults and dependent adults that live in our community. So older adults are those people who are 65 years and above, and dependent adults are those that are between 18 and 64 years of age that need assistance with advocacy in some kind of way. So that's something that if you have questions about that, you can call us. Community, when we talk about community, that refers to, you know, anybody living in the community for the most part, people living in their own homes, apartments, independent assisted living facilities, unlicensed facilities. We work closely with the Ombudsman, and they advocate for individuals living in nursing homes, basically any licensed facility where we do all the unlicensed and everything else. So an important part of APS to know is that it is a voluntary program. We get asked about this a lot. And what this means is that we might get referrals from the community, and we can go out there and we can offer our services, but adults have the right to refuse those services. They have the right to not accept that. So, you know, one of the challenges with adult protective services is trying to balance the duty to protect our most vulnerable individuals in the community with that individual's right to their own self-determination. Next slide, please. Okay, so there are many different types of abuse that we investigate and respond to, and they basically fall into two main categories. There's abuse by others and self-neglect. So abuse by others is usually there's an alleged perpetrator. With many of these kinds of cases, we work closely with law enforcement, the DA, and we look at the criminal component of that. And then with self-neglect, there isn't necessarily a third party involved, and it involves like physical care, medical care. We receive more referrals on self-neglect than any other type of abuse. So around 40% of the referrals that we receive involve self-neglect. And then the next highest category that we receive referrals on is financial abuse. So that can include like sweetheart scams, the social security calls people make, people saying, pretending to be from somewhere else, saying that their computer's broken, or even like family members or caregivers taking people's money. So that's a huge issue that we come across. Every month we receive around 133 referrals through the APS hotline, and about 60 of these get assigned to social workers. So sometimes they don't meet all the requirements. People might live out of state, or maybe it's with the Ombudsman. So we respond to about 60 cases every month. Next slide, please. So when we do get a referral, the social worker wears many hats. There's, first of all, they're there to investigate the allegations and determine findings. And then the second part of that is providing the social work side of it. So providing information and referrals to community agencies, which can include law enforcement or working with hospitals, hospice, public health, behavioural health and recovery services. So we work with all these different organisations. We do face-to-face visits, needs assessments, remedial and preventative social work activities, and occasionally provide tangible services as resources allow. So just before I end, I just want to say that the success of our program is really reliant on the collaboration and the strong partnerships and relationships that we have with not only other programs and services, but the community itself. We really rely on friends, family members, neighbours, anyone in the community, really watching out for our most vulnerable community members and calling us if you have any concerns at all. The community steps up in so many ways to help us address these protective issues, and we couldn't do this work without you. So I look forward to answering any questions at the end, and please call us if you suspect or want to consult with us on any kind of situation. Thank you.
Hi, good evening, everyone. It's a real pleasure to be here tonight. My name is Tony Milani. I am a senior child welfare worker with Marin Children and Family Services. I was born in Marin, grew up in Marin. I live in Marin. I've worked for the County of Marin for 13 and a half years. So it really is a real pleasure to speak to the community. Quick note about our name. Many people refer to us as Marin Child Protective Services. However, about a decade ago, our department realized that even though our main prerogative is to keep a child safe, that doesn't happen without that child's family. So we changed our name, and it really makes the most sense and works well in the community. Next slide, please. Okay, we are located at 3250 Kerner Boulevard, which is the County Connection Center in San Rafael in the Canal neighborhood. You see Gardenia's Market and take a right into the parking lot, look straight ahead, that's our offices. The most important info is our 24-hour hotline number, 415-473-7153. Any person, and that person could be law enforcement, a teacher, a neighbor, a family member, anyone, a friend of a child that has a concern about the child's safety, well-being, calls that number and makes a report. I'll get to that more in a minute. The clients we serve are any child from 0 to 18 years of age. Although I would point out that in some cases, we do work with children who are young adults between ages 18 and 21. Next slide, please. Okay, so as I mentioned earlier, if someone has a report about a concern about a child, they call our hotline number. Our intake staff, step number 2 is our intake staff assesses if the child is at risk of physical, emotional harm or neglect by using what we call evidence-based tools. These are techniques we use that are research-based and have been proven to assess safety of children. If the child is determined to meet the criteria for being at risk of physical or emotional harm or neglect, a child welfare social worker is assigned to respond in person to meet the child. Step 4 is the social worker meets with the child, family, and others in the child's life to determine and assess safety of the child, again, by using our evidence-based tools. Then that we move to step 5, which is the social worker will give resources, will be given to the family to enable the department to leave the family knowing the child is safe. However, if the child is not safe, the department may need to make an alternative plan to support the safety of the child. This is the last resort of the department. We'll talk more about that in a moment. Next slide, please. So the efforts the department makes when a child comes to our attention to ensure the child's safety is we work with several community-based and county-based organizations to support the family and the needs of the child. Some of the government organizations we work with are CalWorks, Marin Youth and Family Services, Marin Behavioral Services, Marin Housing. Some of the community-based organizations that we work with are Homeward Bound, Adopt a Family, St. Vincent's, Novato Youth Center. Marin really is known for a lot of great community-based organizations, and the department is proud to work with all of them. It really helps keep families and children safe. When we work with a family, the department's main goal is to provide safety planning with the caregivers and their networks of supports. To do this, we conduct child and family team meetings facilitated by the department's social workers, valuing the perspective of the family and engaging their network of supports with the goal to ensure child safety. I want to repeat that. We value the perspective of the family and engaging their network of supports with the goal to ensure child safety. The department also will offer voluntary services through our family preservation program in an effort to maintain children in their home with natural supports and sustainable resources that I mentioned earlier. Now, in some cases, sometimes to ensure a child is safe, the department needs to place a child in foster care. And we have a very robust foster parent network here in Marin. However, we're always looking for more foster parents. And I'm going to give a website right now called fosterourfuturemarin.org. Again, fosterourfuturemarin.org. I'll be around after the rest of the presentations to answer any questions you may have. And now I'm going to pass the presentation to Mark from the Public Guardian's Office.
Good evening, everybody. My name is Mark Vanderskoff, and I'm with the Public Guardian Office. I'm very glad to get this chance to come before you tonight and tell you a little bit more about our office. I'm going to be talking with you about conservatorships. I think there are a lot of misconceptions about conservatorships, so I hope to be able to clear those up in the brief time I have tonight. And I also can take questions later. So I think we all may know people in the community who are struggling to get by. Maybe they can't make decisions about their medical care. They can't make decisions about their financial care, or their financial assets. Maybe they are not paying their bills. They might be being abused by someone. So these kinds of individuals might be referred to the Public Guardian Office so that we can establish a conservatorship and make decisions for the person to keep them safe. We deal with the most vulnerable adults in Marin. So what is a conservatorship exactly? A conservator is appointed by the courts when an individual is deemed physically or mentally unable to handle his or her own affairs. So depending on the type of conservatorship that's granted, the public guardian might be responsible for housing and placement. We'd be looking at, can the person afford the housing? Is it safe? Do they need another environment? Medical decisions, we'll be looking at, are there medical issues that we can help stabilize with our intervention? Financial decisions, again, we'll be looking at, is the person paying their bills? Do they need assistance in terms of not resisting abuse and financial abuse? And we also make legal decisions. So the goal of conservatorships are to advocate on behalf of the conservatee and also to protect the individual and their assets. I want to briefly mention there are two types of conservatorships. There's the probate conservatorship and the LPS, also known as a mental health conservatorship. Probate conservatorships are generally established for older adults who aren't able to handle their affairs due to illness, injury, or cognitive decline such as dementia. LPS or mental health conservatorships are generally established for individuals who are deemed unable to provide for their food, clothing, or shelter due to a mental illness. So I do want to mention that there are a high number of older adults in Marin. So if you do know anyone that might be struggling with some of the issues that I've mentioned, please call Adult Protective Services, as Camille mentioned. They're a great resource for the community. They can go out and try and hook the person up with services and try and help the situation. If you know someone or a family member that has mental health issues, please reach out to behavioral health. They'll be talking later. They have an array of excellent programs that they can offer people in order to help them. So next slide, please. So the paths to conservatorship, generally, as I mentioned, if someone is struggling in the community, they're going to be coming to the attention of Adult Protective Services. They might even come to the attention of the police. They may be hospitalized for medical reasons, or they may be hospitalized for psychiatric reasons. Any of these entities can make a formal referral to the public guardian for a conservatorship. So what we're going to be looking for if we get a referral is a pattern of poor decision-making, a pattern of unsafe behavior. We aren't going to conserve someone for one or two instances of bad judgment. We accept the referral, and then when we do the investigation, we vet it out very carefully. We interview the person, we interview their family members, we interview their friends. What we're looking for is to see if there's any other intervention that could be tried short of a conservatorship. Or are any of these family members or friends able to step up and assist the person? The more information we can gather during this period from friends and family members is the better for us to make our determination. At the end of the investigation, we may or may not conclude that the person needs a conservatorship. If we do feel that we need to go forward in order to assist the person, then the case goes to the county superior court. We present our case, the potential conservatee, if they're contesting it, sometimes people do and sometimes people don't, They also will have access to a lawyer. And then it's really up to the judge to decide what's best for the person. The judge decides if the public guardian is going to be awarded the conservatorship and decides what powers we will have. If the conservatorship is granted, then the public guardian's job is to manage the affairs for the person, stand side by side with them, and make decisions in their best interest. So next slide, please. So just to wrap up some takeaways, I do want to urge people again, use the resources that we are able to offer through behavioral health services and through adult protective services. They're going to be able to help you if you have questions or are concerned about any individuals. I also want to reiterate that the public guardian is appointed only if other people are not willing and able to take the appointment, and only if other interventions have been tried and haven't worked. If we do accept the case and are appointed, our goal is to provide the conservatee the least restrictive environment possible and to give them the highest amount of independence possible. And as a reminder, conservatorship cases are overseen by the Superior Court, but these cases are managed on a day-to-day basis through our office and our deputy conservators. So thank you. That'll conclude my remarks, and I will pass it on to Maria.
Thank you, Mark. Good evening, everyone. It's such a pleasure to be here with all of you today. The rest of this presentation is going to discuss specifically the Division of Behavioral Health and Recovery Services. My name is Maria Rea, and I am the Outreach and Engagement Coordinator, and I will be talking about our prevention and outreach efforts that we're working on currently. So we are working on increasing our community awareness to BHRS services by utilizing different tools such as our website, social media campaigns, different kinds of advertisements. We're also working on providing targeted outreach to underserved communities such as West Marin and Latinx communities to increase the linkage to behavioral health resources. We continue to improve our partnership to provide culturally responsive and linguistically appropriate support. And we're also building capacity for providers, community members, and schools through consultations, trainings, different learning collaboratives, and we're currently funding and partnering with community-based organizations to expand our behavioral health supports in alignment with our county's equity goals and our community planning process. This year, we've been able to award over 20 contracts to community-based organizations through the Mental Health Services Act Prevention and Early Intervention. And we've been able to expand school-based mental health supports, including supports for newcomers, expanded our storytelling programs, and funding for suicide prevention trainings. Next slide, please. I wanted to show you some of the advertisements. The picture to the left is one advertisement that we have on the bus stops. We also have several on buses. You might have seen them throughout the community. We have on newspapers, radio ads, and we also, if you see the image to the right, it is, we partnered with other Bay Area counties to create a youth-led marketing campaign designed to educate youth about mental and physical health during and following the COVID-19 pandemic. This campaign is called Crushing the Curve, and I invite you to visit it. It includes different media advertisements, TikTok, Instagram, YouTube, Facebook. We're really trying to reach out to youth. And we continue to partner with Each Mind Matters, which is California's mental health movement, and provide resources around mental health. Next slide, please. I would also like to highlight the work of promotores and community health advocates. For those of you that haven't heard of the term before, community health advocates are trained leaders from the communities that they live in that build bridges between the community and different healthcare systems. Recently, we granted funding for promotores to 3 different organizations. The first organization is North Marin Community Services that has promotores for the Latinx community in the Canal area, West Marin and Novato. And the second organization is Marin Nation Advocacy Project that's specifically for the Vietnamese community. And lastly, Marin City Fatherhood Council that's specifically for Marin City residents. We're also currently working on developing a promotores model that will be used throughout the county, and we will develop learning collaboratives so we all can meet and build partnerships and looking for additional funding to increase the number of promotores because we really believe in this initiative. Next slide, please. We also are working on the Marin County Suicide Prevention Collaborative, which was launched on August of this year in response to our suicide prevention strategic plan. The collaborative is comprised of public and private agencies and individuals, including community members, advocates, educators, and more. And we meet the first Wednesday of every month. I really invite you to join us. The next meeting will be on December 2nd at 2 p.m. The collaborative has 5 action-led community teams that are data, communication, post-vention, training, education, and the schools team. And some of the examples of the work that they're currently doing is they're trying to utilize the data to inform gaps and opportunities, developing peer support networks, recommending trainings for different populations, and developing community campaigns for awareness. Sorry, my cat decided to show up. Next slide, please. And lastly, I wanted to share with you that we will be launching our prevention and outreach website. That's a little sneak peek of how it's going to look. It's going to contain all the information more in detail that I provided and additional resources. So we will be sending more information once the website is completed. I look forward to addressing your questions at the end. Thank you so much, and I will pass it to Jessica Diaz.
Hi, good evening. My name is Jessica Diaz, and I'm the unit supervisor of the Access team. The Access team is the entry point to mental health and substance use services for behavioral health and recovery services. So this is a picture of our team. We are comprised of 7 BHRS staff. We also have a staff member who is part of Buckaloo Program's Homeless Mentally Ill Outreach and Assessment Team. This clinician specializes in working with our homeless population in Marin County, especially with adults. They're also bilingual. We are co-located. Our main office is at 250 Bon Air on the grounds of Marin Health Medical Center. We also are co-located at 3270 Kerner in San Rafael, where we provide child and youth assessments. And then we also have field assessments available. So pre-COVID, we were able to be in schools, at different health clinics and primary care settings, and also in people's homes. We still have field assessments available, taking in mind COVID precautions. 7 out of 8 members of our team are bilingual in Spanish. And something that we're proud of is that 5 out of 8 members of our team are former interns. We have a robust intern program at Behavioral Health and Recovery Services. And so we're very proud that our team has gone through this intern program and learned our system of care before becoming employees. Next slide. So I want to take you through what Access does. We maintain a 24-hour access line where we provide information and referrals, including crisis services. And that is where we would take the majority of our requests for services. So the requests of services that we receive are for psychiatry or medication services, case management, psychotherapy, and substance use referrals. Though our line is 24 hours, we staff it with county staff during business hours between 8 a.m. and 5 p.m. So our line is always staffed, and we have a contractor who provides those live in-person calls after hours. But to move through the rest of this process, I would recommend that you call during business hours. After hours is really looking at providing resources for crisis services. At the time of the call, we would verify someone's insurance or other eligibility. So our main population are Medi-Cal recipients. Someone might have Medi-Cal and Medicare, or they may be low income and uninsured. So we do receive calls from people who have private insurance, although we would be able to provide information about services like support groups and other connections to services in the county or Health and Human Services. In order to access our BHRS programs, contractors, and resources, you need to meet at least the eligibility criteria for being a Medi-Cal recipient, Medi-Cal and Medicare, so not Medicare only, or low income and uninsured. So at the time of the call, we'll also be providing a screening, which would have two different components, behavioral health and substance use. If at the point of screening, we can provide referrals by phone, we'll do so. And if we need to have you meet with a clinician or one of our staff to gather more information, we will set an appointment for you either in person in the office, one of our offices, or in the field by phone or by Zoom. At the point of the appointment, you'll meet with a clinician. The clinician will discuss with you your current needs, any mental health history that you might have had, and other impacts to your wellness and health. That is our assessment process. After the assessment, we determine eligibility. If you're eligible for specialty mental health services, you'll receive referrals to our behavioral health and recovery services programs, which include the services that I mentioned: psychiatry, case management, psychotherapy, or substance use programs. Or we also have a network of community-based organizations that provide psychotherapy. If you don't meet criteria for specialty mental health services, you will meet criteria for mild to moderate services, which include referrals to Beacon Health Options and or primary care. So there's a misconception that if you don't meet criteria for our county services, you're denied services, when in fact, you do meet criteria for mild to moderate services, and we'll help connect you. In addition, we provide services and substance use referrals. We have internal BHRS programs for adults for substance use services. And then we also have a network of providers and community-based organizations that provide outpatient and residential treatment for youth and adults. So Access is that entry point to mental health and substance use services for the county. And we meet with people through the lifespan. So as young as 2 and as old as 100. Next slide. So we receive referrals from everywhere. One of our big referral sources is people referring themselves or family members. We also receive referrals from healthcare providers, inpatient hospitals, community-based organizations, homeless outreach programs, criminal justice referrals like probation, schools, and social services programs. So we have a lot of partners in the community, many of whom are on this call presenting today. How to contact us, our 24/7 access line is 1-888-818-1115. We also have a public email, so feel free to email us at bhrsaccesspublic@marincounty.org. I look forward to taking any questions that you have at the end. Thank you.
Hi there, everybody. My name is Todd Paler, and I'm the Program Manager for Behavioral Health and Recovery Services Crisis Continuum. And the Crisis Continuum encompasses our mobile crisis team, our transition and outreach team, as well as our crisis stabilization unit. First, let's talk a little bit about our mobile crisis response team. So our mobile crisis response team is a mobile field team that can basically go anywhere in Marin County. We serve all residents, somebody here visiting, somebody just passing by who happens to be in a behavioral health crisis, We serve people regardless of age or ability to pay. Our services are free and are funded through a combination of grants as well as our Mental Health Services Act that was referenced earlier. Our mobile crisis team can provide crisis de-escalation in the field, brief mental health and substance use assessments, as well as counseling, crisis counseling. We do risk assessments to determine, people's safety levels and the level of intervention that's needed. We get involved sometimes in conflict resolution as a means to de-escalate the crisis, psychoeducation, both to referring parties and or support people. We do safety planning with people. These are all part of our crisis intervention that we could do in the community. We also make referrals. Sometimes we're the entry point for people who come into the system, and sometimes we're making referrals into our transition outreach team, which is our follow-up team, and then ultimately sometimes to access and to long-term and more planned services. If warranted, our team has the ability to place people on a civil commitment hold, otherwise referred to as Welfare and Institution Code 5150, but that would only be for a person's safety and if a person can't engage voluntarily around that. Our goal is always the least restrictive intervention. And good news, recently, actually we're about 2 weeks now, we have expanded our hours through a grant that we received through the California Health Facilities Financing Organization, CHAFA. We have expanded our hours and we're now open Monday through Friday, 8 a.m. to 9 p.m. And Saturday, 1 p.m. to 9 p.m. And anybody can call us, and our phone number is 415-473-6392. Next slide, please. And then next is our transition outreach team. Sort of a short way of saying it is I kind of think of this as our crisis follow-up and linkage team. And we serve adults, children, youth in behavioral health crisis that are putting them at a risk of loss of housing, loss of employment, decline in school performance, at risk for out-of-home placement, at risk for a 5150 or a crisis assessment or an inpatient hospitalization. Sometimes we get our referrals from our crisis stabilization unit or inpatient units or our mobile crisis team. And the team can work with people up to 60 days, but sometimes we go a little bit further than that, depending. And our goal is to mitigate the crisis situation, figure out what's going on, work to stabilize the situation, and then link them to a more long-term resource and more long-term care to continue the stability that's been achieved with the intervention of the team. We tend to respond to referrals within 1 to 3 days. So we're not in an immediate crisis situation. That would be our mobile crisis team. You can, next slide, please. Thank you. And then finally, our crisis stabilization unit. The phone number is located right there, 415-473-6666. And we serve everybody, all age groups, I think the youngest we've ever had, we've had a 5-year-old, unfortunately, who's come to us, and we can, all age ranges, if you're up to 100, over 100, we can see you. So clients can arrive sometimes involuntarily on a 5150. We are the main 5150 receiving facility in Marin County. And so we're kind of a true social safety net service. But people can come to CSU voluntarily as well for psychiatric evaluation. And we serve everybody in Marin or just coming through Marin, regardless of financial status or insurance. We do have criteria around medical stability. And if a person's not medically stable, they're going to be, then we work with our partners through Marin Health. We are located, by the way, on the campus of Marin Health Hospital at 250 Bon Air in Greenbrae. And so we have a very good working relationship with the hospital. And If a person is too medically unstable to be on our unit, then we partner with the emergency room to have the care there. Our unit is certified by the Department of Healthcare Services to be a 24-hour unit. And so we evaluate, and then if a person needs to be, can be discharged into the community, we will do that. And if a person needs continued observation and treatment, then we will refer to an inpatient psychiatric hospital all over the Bay Area. Our first choice is to go to our partner agency, Marin Health Hospital and Unit A, which is located literally 5 feet from our unit. Our objective in CSU is to really make sure people are safe. Ultimately, that's really the ultimate goal, and to mitigate the crisis, to work to stabilize an individual, and to get them to their appropriate the appropriate level of care. Just very, very briefly, during the current pandemic situation that we're in, we have also partnered with Marin Health Hospital to provide better infection control on our unit. And so everybody who comes onto the unit, either being evaluated voluntarily or on a hold, are actually rapid COVID tested in the Marin Health Medical Center. It's also it's affected our visitation. We used to be completely open in terms of visitation. Right now, due to the pandemic, we are only allowing a legal guardian or parent visitation with, of course, agreement for them to be masked up and to not be, to not have any kind of symptoms or anything like that, as we're trying to have our good infection control. So thank you so much. That is those are our main crisis services at Behavioral Health and Recovery Services. And I'm totally open to questions at the end. And now I'm going to pass it off to Jordan Hall, who's also with Behavioral Health and Recovery Services.
Good evening. My name is Jordan Hall, and I'm with Behavioral Health and Recovery Services on the Substance Use Administration team. Marin County operates a full continuum of care for substance use treatment services for Marin Medi-Cal beneficiaries and Marin low-income uninsured residents. If you need access to substance use treatment, we operate a no wrong door policy, meaning you may contact any contracted provider directly for screening and assessment, or contact our integrated access line for screening and referral services. And that number is listed at the top of this slide. Our continuum of care includes primary prevention, early intervention, outpatient, intensive outpatient, residential, and withdrawal management services based on individualized assessed need. We also offer collateral services such as case management and recovery support services at provider sites and through contracts with our 5 recovery coaches. We also have available medication for addiction treatment, which is often referred to as MAT, through a contract with Marin Treatment Center. As mentioned before, in order to access services, all potential clients are assessed via the ASAM criteria. ASAM stands for American Society of Addiction Treatment, to begin the process of establishing medical necessity and identifying the most appropriate level of care. We contract with many local providers for substance use treatment, including Bay Area Community Resources, Centerpoint, and Buckaloo, just to name a few. The county also operates the Road to Recovery treatment program. For an exhaustive list of our contracted providers, please refer to our provider directory at www.marinhhs.org/substance use services. Currently, all of our treatment services are open and operational either through telehealth or in some limited cases in person as allowable and in accordance with state and local COVID-19 guidelines and protocols. I think we're already on the next slide, so it's fine to leave it here. One of the most common questions we get about substance use services is how to access withdrawal management. In Marin County, our local residential withdrawal management provider is Buckaloo Services Helen Vine Recovery Center. Helen Vine operates an ASAM level 3.2 withdrawal management program and utilizes a social model detox program, which focuses on peer-based support and group therapy to assist clients with coping skills, early recovery tools, and relapse prevention. While Helen Vine is able to allow clients to take prescribed medications as indicated, they do not provide on-site medication evaluations and management of those medications. Nonetheless, Helen Vine actively coordinates with outside medical providers and will arrange for transportation to appointments for medical or medication adjustments as needed. The facility itself has a 26-bed capacity, of which Marin contracts for 21 beds, which are flexed between withdrawal management beds and residential beds. Prior to accessing withdrawal management services, any potential client must be willing to engage in a phone screening with Helen Vine staff, as well as complete an in-person assessment to confirm the appropriate level of care. The amount of time engaged in withdrawal management services is dependent upon ongoing individualized assessment, but a typical withdrawal management episode is roughly 7 days. In addition to residential withdrawal management, Helen Vine also offers 3.1 and 3.5 residential treatment. Residential level 3.1 provides 24-hour structure with available trained personnel and at least 5 hours of clinical services per week in preparation for outpatient treatment. Residential level 3.5 provides 24-hour care with trained counselors to stabilize multidimensional imminent danger and prepare clients for outpatient services. In practice, we typically see clients step down from Helen Vine's withdrawal management program into one of their corresponding residential programs. Prior to admission to residential treatment, any potential client must be assessed by a contracted provider and authorized for services by the BHRS Access Team. Helen Vine operates 24/7 and can be reached for questions and referrals at 415-492-0818. Thank you so much for your time, and I'll turn it back over to Carrie.
Great. Well, thank you so much, everybody. I hope that was useful information. We do have some questions, so I'm just going to take us through those questions and give them to the appropriate person to hopefully answer. It looks like the first question is appropriate for you, Jeremy. The question is, can a person get both WIC and Calfresh at the same time?
Sure, Carrie. That's a good question. And for those unfamiliar with WIC, WIC stands for Women, Infant, and Children, and it's a really great supplemental program to Calfresh. And what WIC does is it provides young mothers with diet courses, information on nutrition, breastfeeding support, and WIC will also provide vouchers that you can use for foods such as eggs, formula, cereal, all the real staples. And yes, normally if you're eligible for Calfresh and you have a young child and you meet the age requirements for WIC, which is having a child up to the age of 5, you are eligible for WIC. So you can apply for WIC either by giving them a telephone call. I can give you their number. So their number is 415-473-6889, or you can email them at Marin County WIC, WIC at marincounty.org to set up your application process for WIC benefits.
Jeremy. We had a question about somebody who wanted to help a friend who has a service dog. So it sounds like maybe a friend with a disability. Camille, I was hoping to turn that over to you, and maybe you can give some information about our information and assistance line.
Absolutely. Within Aging and Adult Services, we do have an information and assistance line that is staffed by 4 social workers, and they are really amazing resource coordinators. They have a large array of connections with a lot of services in the community, and I would say that is probably the best place to start when you're looking for services for any friend or individual that's an older adult or a person with a disability. And the phone number for that is very easy, 473-INFO. And I can't remember the number for that.
4636. I always forget it too.
Yes. So 473-4636, and they will definitely connect you to the right services.
Thanks, Camille. Question for Tony. Tony, somebody was interested in hearing a little bit more about programs for fostering kids or even adopting kids. And then the same person also asked, are there shelters for kids only?
Hi, thank you for the question. The website I gave out, Foster, ROUR, Future Marin, .org really gives, I just looked at it, and it really gives a great overview about how to become a foster parent. Or the person can call 415-473-2200, and one of our staff people will direct them. Basically, the first step in the process, and this goes into the adoptions question, the first step in the process is to get licensed as a foster parent. And then once you get licensed, then we talk about adoption possibilities. We call that FOST adopt parents. Then regarding the shelter, so our shelter is really called our emergency foster home. That's where a youth or a child will go if we go out in the middle of the night, during the day, and have to unfortunately remove a child from their home. There is an emergency shelter that we have here in Marin.
Great, thank you, Tony. Mark, this next question might be good for you. Somebody was asking about a friend who has no family to help them out and what they should do.
Hi, yes. So they have no family, no one to help them out?
Yeah, there's not a lot of other information provided, but just generally.
Well, generally, if you're concerned about the person and you feel that they might be at risk in the community, I think contacting Adult Protective Services is a good way to go. They will be able to go out and put eyes on the person and see if the person does need assistance and what kind of help they might need. I think that would be probably the best resource. I mean, if they need public assistance or benefits, then they could go to the public assistance program. So it kind of depends on what the issue is. But I think starting with the 473 info number or starting with Adult Protective Services would be a good place.
Let's see, there were some just general questions. People wanted to know our location and if we're on a bus line. So I can respond to that. We actually have a variety of different locations. I believe we have 12 different locations around the county, and some of them are on bus lines. Probably the best thing to do is to go online and look up Marin County Health and Human Services. And, you know, it would depend on what service you're looking for, where the best location would be. There was a question about services for homeless people. Advice for the homeless, where have homeless people been relocated to? So this might be in reference to Project Room Key or Project Home Key. I don't know if there's somebody from behavioral health who wants to address that. Maybe Maria?
Hi, Carrie. It's
Or Benita, yeah.
Talk a little bit about services to the homeless population in Moran.
Great.
I do think that, I do want to say that, you know, we have been really successful here in Marin County with our homeless services. And we have a housing first philosophy where we're really trying to get as many folks out of homelessness as possible and into permanent housing. And so there are a lot of, the good news are there are a lot of entry portals to get people who need housing into services, they have to get an assessment, and they can either, and the assessment form is called a VSPDOT that they have to get started. You can get that assessment through a variety of our offices in Health and Human Services, as well as through some of our community partners, such as Ritter Center, and some of our other community partners. So I would encourage someone looking to help a homeless friend to connect with our office, one of our offices, to try to get that assessment, and also and then they can help them assess what their needs are and how we can best support them getting into housing. There are, we did, as Carrie mentioned, our new project Home Key project was just approved by the Board of Supervisors, and we're really excited because we have 2 new facilities coming online soon. One is in San Rafael and one in Corte Madera that will offer some additional permanent supportive initially some interim housing or intermediate housing, and then in about a year or so, we're going to be able to have more permanent supportive housing. So there are some really good options coming along. We continue to work really closely with our homeless population. We've been really proud that during COVID alone, we've housed over 100 people, and our program over the last few years has housed over 300 homeless residents. So we continue to work really hard on this area. So please seek us out so we can try to connect your friends to services.
Thanks,
And do
Benita.
you mind if I add something to that, Carrie?
Yes.
Please do. Go ahead.
So Calfresh has what we call an expedited services program, which the normal application process for Calfresh can take up to 30 days. But based on someone's financial situation, or if they're going to run out of food, their application can go into an expedited window and be processed within 3 days. And for those single adults who have no income, the maximum Calfresh allotment is $204. So based on certain clients, within a couple of days could get some real substantial money to go out and buy food. So that's something just to keep in mind for those homeless clients or those clients in need who do not have Calfresh. There is mechanisms in place to really speed up that process for those most in need.
Jeremy. There was a general question about just some history of our organization, how long we've been around. So perhaps we should have sort of explained at the beginning. So we are one of 58 local counties. We are tasked with providing safety net services, so to the most vulnerable in the community. And we do that with a combination of federal, state, and local money. So we are county government. So we're not a nonprofit. We're not a community-based organization. We are one of the 58 local counties. And then there was just a general question about how to make referrals. So I think, the PowerPoint that we did was really rich with resources and phone numbers and websites and information. And somebody was asking if we could post that, and we can certainly post that. Probably the best place to find it is on Marin County Health and Human Services Facebook page. So the PowerPoint that you saw tonight will be available there. Does anyone else want to say anything about just generally how to refer people to the county? I mean, one thing I would say is it's always best if people can self-refer. For the most part, adults have choices to accept services or not. So, you might see somebody who you believe is in need and would benefit from a certain service, and that's great. You can always call on their behalf. But we would need a person's permission in order to be able to, to access any information. So it's always faster, easier if the person is willing, if they're open to accepting services, best to have them call for themselves.
Carrie, may I add to that?
Yes, please, Jordan.
I just want to second everything that you just said. We get a lot of questions in the substance use administration team, for family members and people wanting to refer individuals for substance use services. And really, just like you said, an individual needs to be at least willing to engage in treatment and willing to participate in the screening, referral, and assessment process. So if you have somebody that you are interested in learning services about on their behalf, we can definitely provide you with resources. But in terms of an actual referral, an individual will have to be self-referred.
Thanks, Jordan.
I wanted to add to that as well, Carrie.
Yes.
So also for mental health services, our services are also voluntary, but we have a lot of community members who call for their family members or friends who they believe might need either crisis services or who might need mental health services. And so I really want to encourage folks who have those concerns to call our access line. We will always walk you through the process of eligibility, what types of questions we might ask your loved one, what types of services we provide. And then we also encourage family members to call with their family member. So if we get verbal consent, so if you're calling for your brother and we can hear from your brother, it's okay for us to talk to you and to him. We'd be happy to have that conversation with both of you. So really want to welcome people to call the access line. We will walk through eligibility with you. Even if you have private insurance, we'll talk to you about the programs to differentiate what we do from what private insurance does. So we just really want you to feel welcome to call, even if it's on behalf of a family member or friend.
Thank you, Jessica.
Can I just add to that? So I just wanted to also add to that, just in terms of crisis services, that, sometimes there are situations that you're concerned about your loved ones, from the way that they're behaving and so forth, and that there might be a safety situation and the loved one isn't interested in receiving help or an evaluation and so forth. But we still want to encourage you to reach out to us at Mobile Crisis or over at the Crisis Stabilization Unit, because oftentimes we can get involved and we'll go out there to assess whether we'll try to engage a person to voluntarily work with us and so forth. But in certain situations, we have the authority to compel a civil hold just for the purposes of safety and for the purposes of further evaluation and so forth. But that's always a last resort, but we do have that capacity.
I just want to say something on behalf of the children. One thing I want to clarify about when someone calls our referral hotline is it can be done anonymously. All reports that are made to our hotline, the reporter's information is confidential to the department. Also, not every report is made into what we call a referral, where we do an in-person response. And I just say these things because if you have any concern about any child, please don't hesitate to call our hotline number. Thank you.
Thanks, Tony. And somebody put something really important in the Q&A, which is that it's very important that Spanish speakers know that there are Spanish speaking employees and staff who are working all of these different programs who can help. And that is absolutely true. We have many, many bilingual staff in Spanish, Vietnamese, Russian, Farsi. We are actually, it's part of our mandate to provide services in the person's primary language. So even if we don't have staff who can speak that language, we are mandated to get an interpreter to provide those services. So that's a very important point. Are there any additional questions that people want to put in the Q&A function? We have a few more minutes. Okay, well, seeing none, Benita, I'm going to turn it back over to you to close us out.
Thank you, Carrie. And I just wanted to say thank you to the entire Health and Human Services team for coming out tonight and making this wonderful, wonderful presentation. I learned a lot. I didn't even know myself. You guys did a tremendous job. And I want to say thank you to the staff for your dedication. I want to thank you to all of our viewers tonight, all the great questions that were asked. They were all fantastic questions. It's our goal to provide a great service, and we are always looking to improve. We welcome your feedback on how we can improve. We are so thankful. One of the benefits, COVID has been a terrible situation for most of us in the country, but it has, in terms of opening up our ability and our eyes on different ways to reach out to the community, to provide information, and to include more accessibility, to ensure more accessibility to various peoples. We have expanded the way you can contact us. We have a lot more video accessibility, as well as more phone accessibility for most of our services. And we're very excited about the opportunity to continue to serve here in Marin County. Again, thank you to all our great staff who have service as their #1 priority, providing great service to our community. I want to say thank you for Carrie Biermann and to Connie Marino for organizing this event tonight and doing a great job. It's a lot of work to put together such an event, and they went above and beyond to make sure that our community knows the services that we have available. We will have a recording available for anyone who didn't make it tonight, who wants to view this video later. Again, thank you to our county administrator, Matthew Heimel, and our Board of Supervisors for their continued support of our work and our interest and our desire to serve Marin County residents. And we hope you all have a wonderful evening and a great holiday season ahead. Best wishes to everyone.